you get a white one and a pink one, okay? But then when I say, and my lovely assistant is going to pass out surprises, you're gonna pass out surprises, okay? I'll let you know, I'll point at you. Okay, but for now, look at the surprises. Okay, he's gonna help us out, okay? All right, awesome. Okay, so first off, risk factors for choking, right? Before we even get to the Heimlich, okay? You guys have a lot of these, and if you can't see it, it's also on your sheet. But loss of consciousness. If your patient's known to faint, they have the highest risk of choking. And I listed them in what's higher risk to lower risk, okay? But all these are risk factors. So when you're like, I'm taking care of a new patient, how likely are they to choke? So if you ask yourself these questions, you can kind of stratify, are they high risk or low risk of choking, okay? That's one. Advanced age, right? An age-related slowing of swallowing. So we've got something called the oropharynx, right, in this area, kind of between the space between your mouth and where your lungs and esophagus or your stomach separate. So right in this area, okay? As we get older, the muscles usually are rhythmic. They push food down. As we get older, they kind of move like that. So if there's a piece of food there, instead of pushing it down, you can actually lodge it in between. So the muscles are actually kind of support the piece of food in their throat, okay? Which is dangerous. Another one, so if they look like this, they're probably more okay. If they have a couple of teeth in there, like one tooth here, snaggly there, that is a higher risk, because what it does is when they chew the food, if it's not mushed up, it creates weird forms, so they're more likely to get lodged in the throat. Okay? Some other stuff, medication use, particularly anti-cough medication. Okay, so if they're on things like guafenicin, Tessalon pearls, anything that's a cough suppressant actually makes the muscles work worse. Okay, so keep that in mind. If they're always coughing under a cough suppressant, they won't cough, they'll just choke the next time. Okay, awesome. Dysphagia, obviously if they've had a stroke and they can't swallow, be very careful, but that's easy to identify. For instance, particularly if they're severe, like bowel and bladder incontinent, having other impairments, they're at very high risk. Even with mush, they can choke. Okay, awesome. Questions so far? No? We're cruising. All right, let's keep going. Language, this means they're choking, okay? All right, so I've got a nice guy here, right there. So if they look like that, that's the universal choking sign, all right? If they're looking like this, that is super duper universal choking sign, okay? So eat and swallow your chicken. Chew it, please. It's gonna call me to do it, I promise. If I ask one question, you will not have to answer the follow-up question. That's just bad for me, okay? So a few people are comfortable attempting it. Some things to keep in mind, okay? Know when help is needed. For example, you're comfortable, you run up, and they're choking, right? But now they're turning blue and not breathing. Okay? Don't feel like you have to resolve the situation yourself. Call for help. At that point, maybe even call 911 as well. Okay? If they're not turning blue, if they just started to choke and you're comfortable, maybe get in there and intervene, right? If they're turning blue or if they've stopped breathing, right? That's a time to definitely call for help, another individual, and also call 911. Guess what the rate of hurting yourself during Heimlich is in a skilled nursing facility, is what the data showed. Yes, so 1 out of 3 patients assistants, nurses, doctors will hurt themselves during the Heimlich, okay? So if the patient is like, 400 pounds, please don't attempt the Heimlich, okay? Because if they lose balance and fall on top of you, that is really bad, right? If their girth is really big, like we're talking, you can't meet your hands around their abdomen, please don't try the Heimlich, okay? Because they will lose balance, or they can fall on your leg, you can hurt yourself, okay? And hurt your back as well, right? So please don't hurt yourself. Like I said, 1 out of 3 people attempting this in a skilled nursing facility gets hurt. All right, awesome. So choking first aid. I like this one, I stole it, I gave credit down there. If someone's choking you guys, everyone goes for the Heimlich. Back blows are non-inferior to the Heimlich, okay? So meaning that if you hit from the back, it's not worse than actually doing the Heimlich. So which one is more dangerous for you as a performer? The Heimlich, right? So but back blows are easier, okay? So with back blows, people just kind of tap on their back. That is not what you're doing. You're gonna find where their ribs end. So kind of grab them by the side, see where the ribs end. You're going to trace that to their back, and your palm should strike right above that area, okay? So where the ribs are, you track to the back, and your palm, when you hit them, should strike right there. And the force is not directly into them. The force is up. Okay.
How you burp a baby?
What's that?
I said like how you burp.
Yeah, but more aggressively. Hopefully you're not burping your baby as aggressively as I'm doing it. Or maybe, I don't know, they like it. They quiet down. So I understand. So yes, the vector of your hand is in a circular movement above the rib cage, right? Above the rib cage right here. And it's almost like you're making a circle against their back, okay? You're encouraging the food to go up where it came from. Okay, so circular motion, all right? If you need to support them, you can put an arm across the chest and do that as well, okay? Don't knock your elderly patient off their feet. And I would probably, it would probably burp up the food though, so I don't know. You guys can make that decision during the time. Okay, so that you're gonna do fourth, between back blows and abdominal thrusts, okay? If you do 3 of each and nothing's happened, hopefully you already called for help, you're gonna need help at that point, okay? Beautiful. Questions so far? No? We're cruising? Okay, so the Heimlich maneuver. All right, so this, honestly, you guys, physicians don't do it right. Like doctors don't, I've seen them do the Heimlich. They're like interlacing their hands, they're doing all kinds of things that aren't evidence-based, okay? So first off, I want you to practice with me. What you're gonna do is you're gonna take your dominant hand. If you're left-handed, you can take that one. If you're right-handed, you take that one. What you're gonna do is you're gonna make a fist, okay? And a lot of people are like, oh, just put that fist here. Not yet. What you're going to do afterwards, you make a fist, stick your thumb out over your fingers like this. What you're going to do is this part should be as flat as possible. So from your wrist to the thumb should be as flat as possible. So it's almost like a blade. So it's like you're creating a blade. Okay? So there's that blade 2 to 3 fingers above the belly button. Okay? So, blade, thank you. You're like, which way? Blade should be facing into the belly. So your blade is what's making contact with the body, not your fist, your blade. Okay? And that's as flat as possible. You see how that gives you a good amount of surface area? It's kind of like a nice flat space. Not at the belly button, 3, because it locks it in more. Some people go at the hand, so whatever is most comfortable. You can go to the wrist or at the hand. The idea is that you're going to give as much force over that blade as you can when you do the Heimlich. Okay? So we're there. All right, perfect. And then what you're gonna do is you're going to blade it. You're literally picture like a balloon, which don't worry, I have balloons. Don't tell anyone. Sealing those balloons, yeah. Okay, so it's picture a balloon. Okay, you don't want the balloon to go down. You want the balloon to go upward. Okay, so picture your body cavity as a balloon. So when you grab it and you push, you're gonna push in first into their bodies, and then you're gonna blade it up until you feel their ribs. Okay? So you're gonna push in, 2 or 3 fingers above the belly button, push in, and don't be shy here, okay? When you're doing it to the patient, really dig in, because the more of that you catch, the more likely you're gonna generate enough pressure for that to pop out. Okay? So it's not just a light one. You're gonna, tuck it in as if you're pulling them in, and then you're gonna blade it up to the ribs, and you're gonna repeat that up to 5 times. Okay? And they're pretty firm. You're kind of trapping that balloon in there. Okay? The weaker they become. So this is, you'll tuck your elbows in, you're gonna generate a lot more force. If your elbows are out here, you're gonna generate very little force. Okay? So I'm trying to generate as much force as possible without hurting yourself. You're going to do what with your elbows? In. Tuck them in as close as possible. I mean, if they're like real big, right, you might have to have them out a little bit, but even around their body, tuck them in before you blade, okay? Because that gives you a lot more strength in your joints. You're using more your torso rather than your arms as soon as you drop your arms. And in any task you're doing, if you need to generate some force, remember that. If your arm's out, that's weak. You put your elbows in and all of a sudden you can generate a lot of force, okay? Awesome. Balloon? You have one in your hands? No? Okay. All right. Okay. All right, just kind of make a knot there. Let's get the balloon ready. All right. This kind of look like a patient. If you put it against your body, your lungs are right here, okay? And your diaphragm, the stuff that separates your bowels from your lungs, is right below it, okay? When you're pushing with that blade, right, you're gonna push the bowels into the diaphragm, and the diaphragm is gonna press the balloon, okay? I don't have bowels, we just have this. So when you do it with a balloon though, the top and the bottom, if you're squeezing the balloon up higher, say you start right at the ribs, you're gonna try it. You're gonna push the balloon, right? And then feel it. The balloon expands downward and upward, okay? All right? The balloon expands. So if you're too high, meaning more than 3 fingers above the belly button, the balloon, as you're pushing on it, some of the pressure escapes downward, right? Feel it. You feel how it goes down? And some of it goes up. Okay? That's not good. That's how we're going to start at the very bottom. So when you're squeezing, practice this. Get your fingers the way you would, right? Blade into the belly button. Pretend the belly button is towards the bottom here. There it is. You're going to grab your hand, right? And when you squeeze, is this the right way to do it? No. Tuck your elbows in as much as possible. And then what you're going to do is you're going to squeeze in and upward. In and upward, right? Yes, that's exactly right. So if you notice, before your balloon came out of your hands, it was awesome. Because when you squeezed it, you saw this little tip expand. That's what you want to see, okay? So you're going to blade, right? Get your blade. You're going to put it down, right? About a third of the way down. Then you make a okay. All right, so please remember, you are so important in any task you do to help the patient. So we totally appreciate what this facility does, I do, because without caregivers, there would be no care. Okay? So please be kind to yourself. Sometimes I'm hard on myself. My brain gets away from me and says very negative things. But remind yourself, you know what? You're awesome. Thank you for what you do. Can I pass this around? You don't have to do this, but just think about what message would you send to yourself? Or maybe a message that you would send to your younger self. Maybe that's someone that was struggling. Just think about something that, they would appreciate. Okay?
It's okay. We're just
All right. Well, like I said, we're Albuquerque Hospice and Palliative Care. We're the new kid on the block, so but we have an excellent team, and I think we're really going to provide excellent care. So if you need our services, please let us know. Okay?